Well, I think it's a major step forward. In the 6 months of COVID, we've all been searching for a drug that will actually improve survival. And today, for the first time, we've got one. It's a good news day.
How did it come to your attention as a possible breakthrough drug?
Well, this drug, dexamethasone, a steroid drug, has been around for decades, used to treat inflammation, a whole range of conditions, arthritis and so on. And people have tried it off and on for infections, and particularly for lung infections, but with inconclusive results. And so back in the beginning of March, when we started out tackling COVID in the UK, we started out this trial. It was an obvious candidate. I don't think any of us had huge expectations that it would work. But what we've seen today is really quite impressive and compelling results, particularly for people on ventilators, as I think you were saying, reducing the risk of dying by 1/3 in those patients. And if there are patients in hospital who need oxygen, reducing the risk of dying by 1/5. So it's a significant step forward.
Yeah, and primarily, as we've been saying, for the sickest patients. So what does it actually do? How does it work?
Well, what happens is that for many people who get a coronavirus infection, it will just be a flu-like illness, if you like. It's a virus illness. But as that progresses, the body's immune response, instead of being helpful and dealing with the infection, starts to be harmful and actually, if you like, attack the lungs and cause the lung failure that leads to people to need ventilators and then, as we know, for many people to sadly die. So dexamethasone suppresses that. One of the really nice things about this is that it's a treatment we've already got. It's sitting in the drug cupboards in every hospital in the country. It costs about £5 for a course of treatment, and it has a good and big effect in the patients who most need it.
Yeah, and I'm just reading that this could be available by next Tuesday, I think, on the NHS, which is, as you say, good news. I mean, how many lives could it have saved, do you think? Is there a figure you can put on that?
Well, if we'd known at the beginning what we know now, I think we could have perhaps saved 5,000 lives. Now, we didn't know what we know now, so it's not a missed opportunity. We did exactly the right thing. I think we, being the UK, in doing these sort of clinical trials, right alongside clinical care to get these sort of results. But you've said next Tuesday. I think, I'm not sure where you got your information from, but I've just seen that the NHS have issued guidelines that making this essentially standard of care for these types of patients tonight. So we announced the results at around lunchtime today, and by tea time today, it's in NHS policy up and down the country.
Do you know what? It does say, it says Tuesday. I just assumed next Tuesday, but you're quite right. Today is, I don't even know what day it is.
Today is Tuesday and it's done.
Yeah, well, it's all good news. I mean, so does it mean that an even better drug could result from the work you've already done, a combination of other drugs, do you think?
Yeah, well, that's certainly a possibility. And of course, that's the way that the research will be moving. I mean, the first thing was find some chink, some hope that we could actually tackle the risk of dying from COVID. We've not just found a chink, we found a sort of, a pretty significant breakthrough for the sickest patients. But that's not a treatment for everybody. And we need to do more because there's still further to go. So, yes, this is a big step forward. It's not the end of the road. Combination treatments are likely to be the way forward. For example, it could be with combination with drugs, but it could also be combination with things like convalescent plasma. Using antibodies that are in the blood from people who've recovered and giving it to people who are sick with the disease. And we're studying that too. So we may well be back with more news.
Yeah, and how much treatment, Professor, is required in each patient to reduce the likelihood of death? I mean, how long do they take it before?
So this is hospitalized patients with needing oxygen or ventilation. It's up to 10 days of treatment. If patients go home earlier than that, then they don't need to continue it. And that total course of treatment is £5. It's essentially, well, it depends on the size of the tablet, but it's 3 little tablets a day for 10 days, or it can be given by injection in the sickest patients. So it's a convenient and easy, well understood treatment for a very affordable treatment with really quite a big benefit.
Yeah,
it's very pleased on.
Yeah, and does it help? Is there any evidence that it helps other patients who may not be as seriously ill or patients who don't require ventilators?
Well, that's a very good question. So in patients who were in hospital, but their lungs were working, and so they didn't need oxygen, they didn't need ventilators, then the treatment did not work. And we didn't study patients who were not in hospital. One of the things is that we think that the drug acts by dampening down the immune system. That's very important. That's beneficial when the immune system's in overdrive and attacking the body. But early on, it's tackling the virus. And so actually, this is not a treatment, at least not at this stage, not without good evidence for patients who are seeing their GP, patients who have a test in the community, for patients in hospital who are not requiring oxygen or ventilation. For the sickest patients are those in hospital requiring ventilation, and that's where it works best.